Another physician I was working with probably had reported that many as well. We just looked at each other and went, what? I think it was in that year that the state said, well, you know, there's so many cases of Lyme being reported in Wisconsin that we really want to concentrate on something that's of public health significance. So we're going to choose whooping cough. It's kind of like, what? And they changed the reporting criteria. So basically now, I basically have to see the erythema migrans rash or bullseye's rash to report a case of Lyme that they're going to count. I report them anyway. I think maybe twice in my 30-some years in medicine have I seen that bullseye rash. You just don't see it walk through the door. Usually by the time people come in, it's gone. So there's, you know, the cases have dropped dramatically in Wisconsin. And it's kind of funny because every year you see it going up and up and up, and now they changed the reporting guidelines, and now it's almost not a problem in Wisconsin, and we predict that pretty soon you'll hear ads on TV, hey, bring your kids to Wisconsin and romp in our parks because Lyme isn't a problem anymore in Wisconsin. Yeah, I'm entirely serious with that. About 30,000 cases are reported every year to the CDC. The CDC's own study 2 years ago, looking at other things, and they didn't even use the best lab in the country, which is IGeneX. Because IGeneX has been beat up so much, they decided not to participate. The CDC estimated there's between 300,000 and 1 million cases every year in this country. That's 6 times more than AIDS. It is the largest epidemic that we have. And you can see the tremendous controversy that is out there about this. Despite some of those arrogant people saying, well, the only way you can get this is a tick bite. It has been recovered from mosquitoes, and who here in this room hasn't had a mosquito bite, okay? It has been recovered from other biting insects like deer flies. It's been recovered from vaginal secretions. It's been recovered from semen. Its cousin is syphilis, who most doctors haven't seen. I have seen syphilis. I've been around long enough, but most doctors haven't. But syphilis causes all of these things that Lyme causes, yet they don't think Lyme can cause these things. And one of the things that they didn't go into very much in this is that these ticks don't just give you Lyme disease. There's a whole host of co-infections that come along with this. Bartonella, Babesia, ehrlichiosis, Epstein-Barr virus, chlamydia pneumonia, mycoplasma, anaplasma. I mean, I could go on. And there's 180,000 ticks on the average moose. I used to say 160,000, but I had a 16-year-old come back to my office on her second visit, and she said, you know, you told me something wrong. I said, what was that? And she said, well, you said there were 160,000 ticks on a moose. I said, yeah, that's correct. And she said, no, I Googled it. There's 180,000. So I stand corrected. But the point is, that's like everybody in Milwaukee eating off the same plate with the same fork, drinking out of the same cup, and pretty soon everybody gets what everybody else has. So these ticks acquire a lot of these diseases, and they're very happy to share them with you. So we have to treat all of those. Lyme there's 6 or 7 forms that we've identified in the body. We have to treat all of those. And some of the fallacy of just using doxycycline is that it makes your body a noxious environment. So what do these bugs do? They form cysts. And the cysts are like a bulb or like a seed. They just sit around until the doxycycline goes away. And then in a couple months, they go back to a vegetative state and start causing problems again. So that has to be taken into account. Treatment takes 4 months to 4 years or longer. All of the Lyme doctors in the country kind of communicate in an email. I get about 30 emails a day. And yesterday, one wrote, finally cured this lady after 7 years of active treatment. She finally was seronegative, and her CD57, which is a marker we use, came up normal. That's 7 years it took to have that happen. I would say probably 18 months is my average, and a pretty good average for most people. Diagnosing, they went into that a little bit. And by the way, before I forget, there's a symptom checklist out there that I use in my office. And yeah, anybody that would like one, we can hand one out. I really encourage you to get one and look at that. It's every symptom on there is associated with Lyme disease. And it's kind of startling because you start seeing the width and the breadth of what this disease can do to you. But diagnosis is very hard. One of the doctors up there said, on the video, said, well, some doctors want to make this a clinical diagnosis. Well, you know what? If you go to the CDC website, what it says is that if you look up Lyme, it says Lyme diagnosis is based on signs and symptoms and a history of possible exposure, period. That is a clinical diagnosis. That means we sit down, we talk about it, and we decide if you've got Lyme or not. And then below that it says testing may be helpful in certain cases if used properly. The standard test, if you go in around here and get that done, it's about 30% accurate if you have Lyme. The quarter in my pocket is 50% accurate, okay? So if I can flip a quarter and get about a 20% better result than that test, it gives you a little bit of an idea. And there's a really common belief out there that if you have a test that's negative, you don't have Lyme, period. It's ruled out. Or if you've ever had 2 weeks of doxycycline at any time in your life, you don't have Lyme anymore because it's fixed, okay? And now you've got fibromyalgia or you've got MS or any of those other things they've been talking about. The average person that gets to a Lyme litter doctor has taken 22 months to get there, at which time the disease is pretty well advanced. They have seen 7 specialists. They have spent thousands or hundreds of thousands of dollars on testing, and the story is all the same. It's all negative or normal, and we don't know what's wrong with you, or they get one of these, what I call BS diagnoses. I won't tell you what that stands for, but of MS or ALS or Parkinson's or fibromyalgia or dementia or psychiatric conditions. The most common symptoms that I see, fatigue is huge with this disease, and it's unrelenting, it's tremendous. Next is somewhat between joint pain and cognitive difficulties. I had one gentleman that was from northern Wisconsin, and he was 54 years old. He literally lived in the house he was born in. He worked in a quarry 6 miles from the house, and he'd get lost going to work. He'd have to stop on the road and go, that's Joe's barn. What road is Joe on? Okay, I'm on the right road. I don't know how many times he'd been on that road in 54 years, but probably a lot. He'd get lost going into town, and he lives in a little town. He's been in that town for 54 years, and he'd get lost. I have people that have to use their GPS to get home because they don't remember where home is. That's pretty scary, and that's pretty profound. Beyond that, you can look at all of the symptoms, and I basically say everything else on that sheet. And it might be good for you to go home and mark that sheet and see how many things resemble you on that sheet, because I know there's a lot of people in this room with Lyme. And my belief is probably almost everybody in Wisconsin has been exposed. Now, not everybody's manifesting it, but it's tremendously common and very underdiagnosed. Treatment, I tell people I use antibiotics, I use herbs, I use homeopathics, I use diet, I use exercise, and I use sleep. And I used to joke that I would use the phase of the moon if I thought it would help, and now I know it hurts. And you talk to any Lymies, and they can tell you, some can tell you exactly what the phase of the moon is, and some can exactly tell you when the full moon is. And, you know, one day I had 3 people that had been doing well in my office, and they said, hey, it's the last 2 days I've just been terrible. And I finally looked it up on the computer, and sure enough, it's a full moon. And it does affect people. Weather definitely affects people, and change of season. The one thing that they did stress on here is that it's so misunderstood because people with Lyme look normal. And they go, well, you tell me you're so sick. You look fine. You know, you don't look sick. You don't have pox all over your face. You look fine. Well, they aren't fine. And they get labeled as drug seekers because they complain about being in pain. But you don't look like you're in pain. You know, get out of my ER. You just want drugs. It's really very poorly understood. And I'm guilty. I'm also a microbiologist. I was a microbiologist and immunologist before I went to medical school. And I actually used to teach infectious disease. I used to teach medical school to infectious disease doctors. I taught what I was taught from the University of Minnesota, a pretty good institution that ought to know something about Lyme. I taught it wrong, and I did it wrong for a lot of years. But it's only after you get more education that you learn, wow, was I ever wrong? And a lot of docs aren't willing to do that. I'm going to be quiet now, and I'm happy to answer your questions about what got me where I am, or what about Lyme, or what about something on the movie, or what treatment is like, or fire away.
I have a question about that spiral bacteria.
Mm-hmm.
Okay, you have it. Do everybody that has Lyme disease has that? And if they do eventually get cured, is that gone? Because wouldn't that be easy to tell them that it's gone because now you don't see that spiral bacteria anymore?
Did everybody hear the question? Okay. Does everybody that has Lyme...
Since we're recording, can you repeat it into the mic? Can you repeat the question into the mic?
Yeah, right. That's what I'm doing. That's okay. Does everybody that has Lyme have the spiral bacteria? And isn't it easy to tell when you're cured if that just goes away? Not everybody that has a tick-borne disease has Lyme. I had a patient today that I do some alternative kind of testing in my office. He said, I was out in Colorado elk hunting. He lives in Milwaukee. And he said, I got sick after being out there for 2 weeks. And I thought, well, geez, that's kind of strange because Colorado has one of the lowest incidences of Lyme in the country. And when I did some testing on him, it was Rocky Mountain spotted fever. And I went, okay. There's a reason why they call it Rocky Mountain spotted fever. Not that we don't have it in Wisconsin, we certainly do. But that came up as the most prominent tick-borne infection that he had. So in him, you may or may not find the spiral bacteria, okay? But yet he still has a lot of these have all the same symptoms. No credible Lyme doctor is ever going to tell you that you're cured, okay? Because we don't know if we can cure this disease once it goes chronic. There are so many places it hides in the body. That hides in your thyroid gland, it hides in your cells, it hides in your adrenal glands, it hides in pituitary. And that's one of the ways it survives in the body and avoids the body's defenses. And like I said, there's at least six forms, maybe more. And some of these are designed to survive. So we only will tell you that we think you're in remission and watch out for signs and symptoms to come back, because we don't know if we can cure anybody.
Because it wouldn't show in the blood then. If you took blood out and it's hiding somewhere.
It might not show in the blood. And your test may or may not be positive for life. And you base it basically on signs and symptoms.
So it's possible to be infected?
It's possible to be infected many times. I grew up in northern Minnesota. My neighbor, I found out I lived 100 yards from the hotspot of Lyme in Minnesota. Great, you know. My neighbor who works for the DNR up there has had Lyme 3 times. There are at least 100 species in this country. Heretofore, we kind of thought there was 300 worldwide. There was an article that came out last week that said we think there's 1,000 species worldwide. So there's probably a lot more than 300 in this country. And that's one of the reasons it makes testing so difficult, because you can't test for 1,000 species. And almost everybody in this country, this standard Lyme test I'm talking about, uses one strain of Lyme to test. Igenics in California, who's the only lab I use to test for this, uses multiple strains. So they're one of the only ones to do that. They are the only lab out of 58 labs in this country testing for Lyme that got 100% on their proficiency testing. And yet you hear all the time how bad they are. They do it better, in my opinion, than anybody else in the country. And in their proficiency testing, they did do it better than anybody else in the country.
I've had symptoms for about 8 years and just found this past
Well, the question is, I've had Lyme probably for 8 years. My insurance will pay for an infectious disease doctor. They won't pay for a Lyme-Lennard doctor. What should I do? I'm getting out my crystal ball, and I'm going to tell you what's going to happen if you go to an infectious disease doctor, because I've seen this probably 1,000 times. Well, first of all, there's no such thing as chronic Lyme disease. I don't think you have chronic Lyme disease. Let me do a test, and we will see. Your test is negative. I told you didn't have Lyme disease. Now go out and get out of my office. If they even agree to see you, most won't even agree to see you if they feel that if you feel you have chronic Lyme. Most will not even set an appointment up. If you badger them enough, they will give you maybe, if you're lucky, 21 days of doxycycline. If you have chronic Lyme, the 21 days of doxycycline will only cause the Lyme to form more cysts in your body, but that's okay because they're already there anyway. You might feel better or you might feel worse on that 21 days of doxycycline. And if you do feel better, you will feel better for maybe a month, and then guess what? All the symptoms will come back. At which time you go back to the infectious disease doctor and he will say, you're depressed. Here's a referral to a psychiatrist. So you can make up your mind and then let me know if I'm right, if you choose an infectious disease doctor. That's probably the worst possible place you can go if you've got Lyme disease. I'm sorry, I missed that. Did they? Yep. I think you will be very disappointed. But go ahead and see. Yeah. It's unfortunate. Insurance covers not much of what I do. And it's largely because of the IDSA guidelines. They have said 2 weeks of doxy and you're fine. And insurance companies, does anybody know why insurance companies exist? That's right. Some people actually think they're there to help you. There is one reason why insurance companies exist, and they are to make money. And by the way, they do a darn good job of it. Do you know what the compensation package is? I'm sorry, I'm getting a little cynical. But the compensation package for the CEO of United Health in Minnesota is 1.6 a year. That's billion, folks. That's not million. That's 1.6 billion. That's public record. Think what we could do with that $1 billion if this poor individual could maybe make it by on 0.6 billion a year, what that good could do with 1 billion back in United Healthcare. So, sorry, I get a little cynical. That's why I'm not in corporate medicine anymore. Yeah. Question is about the Lyme vaccine, which was out and available for about 3 years on the market, and probably was quite effective. It was a series of 3 shots, and it was pulled from the market because basically there were some people that had problems, and I don't remember exactly, this was years ago, I don't remember exactly, it was some people had seizures or something, but it's kind of like the 1-800 bad drug. You know, if you've taken this drug and you've had a problem, call this and we'll get you a lot of money, okay? And, you know, it's a very, it's kind of a small market. There's not a lot of profit in companies that make vaccines, and when they're looking at these lawsuits, massive lawsuits of people wanting enormous amounts of money, they said, nah, we're out of here. And I doubt very much that there will be any vaccines for Lyme. There's a couple companies looking at that. It was a live inactivated virus, and probably no, it would not turn into an active, or not a virus, I'm sorry, a live inactivated bacteria. But there's probably no worry of that turning into Lyme disease, or an active case of Lyme disease, okay? There's many examples of that type of vaccine out there. veterinarians and chiropractors, unfortunately, are way ahead of medical doctors when it comes to Lyme disease. Vets, they know it's everywhere, okay, and they can treat it very successfully, and they have vaccines, and so I'm not holding my breath that a new vaccine is going to come out, and I'm kind of sad the old one went away. But again, there's more and more strains of this bacteria, and we don't know how many strains it really would protect you against. So you can get this disease over and over again. Sure.
Are any other countries ahead of us on treatment?
Are any other countries ahead of us in treatment? Probably the only cure that is available for Lyme disease is hyperthermia treatment, which is being done overseas in Europe, where they take you into an operating room and they run your core temperature up probably in excess of 106 degrees and keep it there for a while, and you essentially cook the bacteria, because most bacteria and viruses live in a very narrow temperature range and a very narrow range of oxygen tension, if you will, okay? And that probably will destroy all forms of bacteria. It is thought of as a potential cure. There's some side effects to that, though, and if it's not done very carefully, you cook other things other than the bacteria, i.e. the old squash up above. So, but that, yes, there's much research in Europe. This is a worldwide problem, as the map showed. A lot of countries are much more forward in their thinking about Lyme disease, especially overseas. And, I'm going to get cynical again, but if you ask any doctor in this country who's the best at medicine in this world, they'll puff up their chest and they're happy to tell you, well, we are, of course, okay? Well, that's their ego talking. Actually, we're number 16 in medicine, and we're number 50th in life expectancy. We don't do medicine well in this country. But we're too good to ask anybody else or look anywhere else and find out what the rest of the world is doing. And Scandinavian has got it all over us. They use tons of herbs. They use a lot of other things. We use 80% of all pharmaceuticals produced in the world in this country. The rest of the world only uses 20%. What's wrong with the rest of the world? For Lyme? Well, as I said, I use antibiotics, I use herbs, I use diet, I use exercise, I use sleep, I use homeopathics. I've been known to use energy work. Some people use Rife machines, if you're familiar with those. The experience of a lot of Lyme literate doctors on Rife machines is they don't tend to work for the majority of people. Every now and then you will find an individual that does work for. So, but you've got to really look at everything. This is such a difficult disease to treat. And you've got to, diet is huge with this. And the people that are going to do the best with Lyme are gluten-free, sugar-free, and dairy-free. And the ones that do the best have been on a good regime of vitamin D and omega-3 fish oil and a multivitamin for years. And those are the people that really do the best. Smoking, for example. If you're a smoker, it's almost impossible to treat Lyme. And I have told some patients, go away and come back when you're not smoking, because it's a block to Lyme. If you are toxic, I've seen people come to me and other Lyme docs after years of antibiotic treatment, and they say they're no good, they're no better, and they're kind of frustrated. And we check, and they've got a yeast toxicity. We have to deal with that first. We have to get that out of the way, or you can't treat the Lyme. Or they've got heavy metal toxicity, which, by the way, everybody does in the room here. Okay, I can tell because you're breathing and you live in this country. We're all lead and mercury toxic, and I'm not kidding. It just depends on how toxic we are. So there's a lot of things that can get in the way of treatment, and you've got to deal with those. But supplements are huge, and I read a lot of every book I can about Lyme, And the people that just use antibiotics don't seem to be able to get the job done. You might feel better for a while, and then your symptoms come right back, and then you're right back into it again. You've really got to, use everything you can. I don't say anybody is cured, like I mentioned. I say you've graduated, but I have graduation criteria that you've got to make. And the graduation criteria are, you got to feel good. You got to say, Doc, I'm back. Your CD57 has to be normal, which is a measure of killer cells. And your C4A has to be normal, which is a measure of inflammation via the complement system, which is a defense system in the body. And really what I'm treating is inflammation. I can treat inflammation, and that's the root of all evil with just about anything that's going to happen to you is inflammation. So we've got to get that down. But it takes diet, exercise, lifestyle, and a lot of motivation because this gets expensive, and it takes a while, and it teaches patience. And you've not run across any paradigms like this where, you have a urinary tract infection, you come to your doc, maybe one dose of one antibiotic might turn the tables on this. And I tell people that treating Lyme is like poking the dragon on the movies with the spear. The dragon just doesn't roll over and say, you got me, and play dead. He's whipping his tail, he's breathing fire, he's clawing at you, he's fighting back. And, I generally, when I start people on aggressive treatment, because usually people are so tired of being sick, they want aggressive treatment. And I see them back in a month, the best thing they can tell me is, thanks, Doc, I feel worse. And I'm like, yes, that means I'm doing something. That means I'm killing these bacteria. And you definitely get worse before you get better. And if you don't, either you've just gotten it or you have a very low bacterial load. But there's a thing called a Herxheimer reaction, which is a die-off reaction. I had a patient 6 years ago. She went in for surgery. So she gave her own blood, which is obviously the safest thing you can do, right? She had the surgery. She needed blood. They gave her blood back. It almost killed her. She ended up in the ICU, and the doc said, you're pretty sick. You're allergic to your own blood. She went, what do you mean I'm allergic to my own blood? Well, the hematologist came in and said, well, you're not really allergic to your own blood, but you probably have an infection that's not diagnosed. See ya. Bye. And they just totally dropped the ball. That was actually 7 years ago. Well, what had happened was she has Lyme disease, and these little critters have their little camo suits on, just like turkey hunters, and when they're in your body, you don't recognize them. Those slides you saw, if you draw your blood of any Lyme patient and look at it under a dark field microscope, you'll probably see them running around. But your body doesn't see them because they've got their little cloaking devices on. Well, when they took her blood, they took it out, they processed it, they refrigerated it, all these little buggers died. When they break up, their cloaking devices don't work. So now there was a whole bunch of foreign protein in that blood that actually was in there before, but she didn't see. But when they gave her blood back, they gave her a massive Herxheimer reaction. So her body saw all of that foreign protein all at once, and it almost killed her. Because it's a little bit like discovering terrorists in the middle of a military base. All heck is going to break loose. Well, that's what your body does when it's suddenly under attack like that. But the point being is they knew she had an infection, but they didn't care. And she was sick for 7 more years. And, go ahead.
You say you take some blood out of a Lyme patient, you can see those spirochetes, why don't they do that instead of testing? They test this only 30%.
Okay. The question is, if we can see the spirochetes under a microscope, why don't we use that to diagnose? I told you I'm a microbiologist, okay? Been around in this field for a long time. The way I used to diagnose syphilis, which was a medically accepted way to diagnose syphilis, was to take a microscope slide, put it on a skin lesion, look at it under my microscope, and if I saw a spirochete underneath there, I could diagnose syphilis, and it was all good. I mean, that's end of story. That's the ultimate diagnosis. You can see spirochetes in your blood all day long, and in the medical community, you can't say a darn thing except I see bacteria in your blood. Why? It seems like a pretty good test to me. I mean, there are other spirochetes out there. There's leptospira and a number of other spirochetes, but when something smells like a duck quacks like a duck, walks like a duck, and if you have all the signs and symptoms of Lyme disease and we look at your blood and there's spirochetes under there, I know it's Lyme, you know it's Lyme, but I can't, medically, I can't say anything except we see bacteria in your blood. And that's part of the politics of this, okay? So, I don't know why. Makes sense to me.
And then the other thing that you said too is that this person had blood taken out and then put back into them, and that caused a first time reaction. So would that be, is that another method that somebody in the medical community could use to help diagnose some of the Lyme or some undiagnosed bacterial infection?
The question was, you know, the person I talked about where they took blood out and gave it back to her blood, and she experienced a Herxheimer reaction. Could that be used for diagnosis? Boy, that's like shooting somebody to diagnose a gunshot wound. You don't want a Herxheimer reaction unless you, you know, absolutely have no other choice. And it almost killed her, okay? I don't feel I don't need to do that, okay? Lyme is a clinical diagnosis per the CDC, which 99.9% of the doctors miss out there. I've got other ways that I diagnose it, and I do a number of tests because there is no single test that rules it in or rules it out. Now, there is one company doing a culture for Lyme, and that's, I think, in future going to be the gold standard. If I take your blood and I culture it and it grows Lyme, I can recover the Lyme bacteria. To me, it wasn't there before until we put your blood in, and it probably had to come from you. There have been people that have taken ticks and put ticks on people, and ticks that were known to be sterile, and then checked the ticks for Lyme disease, and if the ticks have Lyme disease, that's de facto evidence that you have Lyme disease. I would much rather have a tick bite me than have a Herxheimer reaction like that. So that wouldn't be a practical way.
Are there safeguards against getting the blood supply from wherever you, because I at one point in time I had to have 7 blood transfusions. If this is so sneaky and hides, what guarantee is there that if a person donates blood, that Lyme would be caught before it got back into another individual?
Question was, what about our blood supply? Is it, you know, if it can be transferred by a transfusion? It certainly can, okay? If you have Lyme, I tell all of my patients, if you've ever had Lyme, you can never donate blood again, okay? Period, amen, end of story. We don't know if you're ever cured. Now, there's a lot of people in this room that have Lyme and don't know it. There's a lot of people in this room that have given blood and may have Lyme. And so in reality, I think that it doesn't occur very much, okay? But AIDS, a lot of people got AIDS before we knew about AIDS. And that's the best analogy is with Lyme disease, okay? When the early days of AIDS, you know, well, is it real or isn't it? Or is it, you know, do you have to be a homosexual or a drug abuser? Or, you know, we didn't know. And there was a lot of misinformation. I really think that in the processing of most of the blood between it being drawn and giving back to somebody, it probably kills these organisms. So I don't think that's a huge risk. Now hepatitis, I mean, they check for that. That's a virus. That's going to survive this processing. But a living bacteria may not survive it. So I don't think that's a huge risk. I think it's a lot riskier walking out in your yard. Well, what about prevention is the question. It's kind of scary. I love to walk in the woods and fall. I don't walk in the woods and fall anymore. I see what this disease does to people, and it scares the living daylights out of me. If I do walk in the woods, I'm going to take permethrin, which is available at Fleet Farm, a number of places around here. It comes in a like a 409 bottle, if you know what I'm, spray bottle, and we used it a lot in the military. We used a ton of it in the military. There probably is some degree of toxicity, but it's probably low. And what you do is you spray down your clothes. I used to spray from about mid-thigh on down. until they're damp, and then you let them dry. And you can spray your boots, you can spray your socks, and let them dry. And then when you wear them, it should last for about 6 clothes washings. It lasts for quite a while. Some people actually roll up about an inch or two of their cuff and spray the inside, and hoping that'll be covered by your socks or your boots. So in case they get inside, if you know, that's one thing you can do. DEET, there's a couple products out here on the table which help. Okay, you can buy, there's a uniform company, I think it's called Insectishield now, that has permethrin embedded in your clothing, which will help, and that lasts about a year. They guarantee it'll last about a year. But there is no guarantee. We think mosquitoes might transmit it, okay? Don't get a mosquito bite this year, by the way, okay? All right? You know, how are you going to prevent that? How about deer flies? How about, you know, other things? A lot of my patients are females from Chicago, and their idea of camping, their tent has Hyatt on the top of it, okay? And they're like, where did I get it? Well, do you have mice in your yard? Sure. Do you have raccoons in your yard? Sure. Do you have deer? Even in Chicago, you have deer in your yard, you know? I don't know of any real practical way. And I had a lineman who's, you know, think of a lineman. What is he doing? He's crawling through ditches all day. He's walking through tall grass. And he tried the permethrin trick, and he called in and he said, I had 20 ticks on me today. And I'm like, well, you probably would have had 300 if you didn't put the permethrin on. So there's no 100% ways to prevent this. You know, blousing your pants into the top of your socks or boots, do you know what I'm talking about? That's one way that kind of keeps them on the outside. If you wear lighter colors, you can see them. But especially this time of year, you saw how small those ticks were. And they're, in the early summer, they're about the size of a period on a piece of paper. Now, I pick thousands of ticks off me. I never have knowingly picked a deer tick off me or never seen a nymph on me. I'm sure they've been there, okay? I've never seen one. So I don't know that there is there's no 100% way. You can clear wood piles out of your yard, you can keep your grass mowed, you can put insecticides on your grass around your house. I mean, I know Dr. Horwitz, who was in this movie, he sprays his yard about every month. He's absolutely paranoid. And I mean, he lives out in New York, and I was out there. They have a little different deer than we have here. They are like dogs running all over out there. So it's really common out there.
Do you think there might be some people that are immune if they would actually, you know, get bit with one that has it?
You bet. The question is, are there some people that are immune? You're at work, somebody gets a cold, okay? 4 people in your office get a cold, but not everybody gets a cold. But everybody was exposed, okay? I really do believe that almost everybody in Wisconsin has been exposed. I think there's a lot of subclinical cases, meaning that, you know, I'm probably one of them. I test positive, but I don't know that I have any symptoms right now. I'm probably going to treat myself at some point because I think as I get older and my immunity waxes, it's probably going to cause a problem. But I do think that there are people. My mother was diagnosed with MS. She had MS for 10 years. That was 30 years ago, okay? I went to visit her Friday. She's 93. She hasn't had MS for 30 years. She didn't have MS. MS doesn't go away. She had Lyme disease, okay? She got over it. And with good diet, good nutrition, and good vitamins, she's a dietitian. She knows how to take care of herself. She got over it. And I think a lot of people have it and get over it. And some don't. It's like anything else. It depends on your dose. It depends on your immune state. I see a lot of people. Example, 17-year-old high school football star doing great. You know, physically active, no problems, went in for a 20-minute appendix removal, which turned into a 5-hour gangrenous gut removed. It was worse than they thought. Fixed the kid up. Still, 17, I don't care what you do to him. Week, he should be up playing football almost again. He crashed. And the surgeons go, I don't know what's wrong with him. We fixed him. He doesn't have a leak. He's doing fine. And the internists are like, or the pediatrician's like, I don't know what's wrong with him. Well, he had Lyme, but he was so vital and his immune system was so good, he suppressed it until the first major stress of his life. which can be the surgery, it can be a car accident, it can be a divorce, it can be financial, and that opens up the gates and let these little buggers run. And that is very, very common. And I know I've got patients that have had it for years or congenitally. Maternal fetal, despite what Dr. Shapiro says, that there's no evidence. That's really arrogant because there's a lot of evidence. And maternal fetal is very, very common. I have whole families where the mom gave it to everybody before she knew. And now I'm treating them all. They're all in college now, but I'm treating them all. And mom feels pretty bad about it, like a bad mom, but she didn't know she had it. It's not a bad mom, but it's very, very common.
CD57 ranges, it's a marker you said.
Mm-hmm.
What's a normal CD57 number for a healthy person versus what you typically see in a Lyme patient that has some moderate to severe symptoms?
Okay, question is CD57. I mentioned that a couple of times, and what's a normal range for that? CD57s are killer cells in the body, and the analogy I use is if we went to look at automobiles, all automobiles, and then Chevrolets, and then Chevy Malibus. In the body, it would be white blood cells, killer cells, and then CD57 killer cells. So, if we look out in the parking lot, a lot of cars, a lot of Chevys, only a few Chevy Malibus. So it's a very select population in the body. And the killer cells are hitmen, are bouncers. They go around looking for foreign protein. When they find it, they figure it's there to do us harm. They try and beat it up and throw it out. Well, bouncers don't always win, and sometimes they get beat up. And there's 4 things that we know of. There might be more, but there's only 4 things that we know of that cause that population to be down. Leukemia, lymphoma, tuberculosis, or Lyme disease. I use Marshfield Labs exclusively for that, because everybody does that test a little different. And a lot of them I just can't interpret because they throw CD8 with CD, 57, and their results are very hard to compare. Normal at Marshfield is greater than 120. It takes about a year of you having the disease for that to be pulled down and be abnormal. So if you can get to me within a year, it's probably going to be normal, and that's great because you have tools to fight back. If you've had it somewhere around the 3 to 5 year point, it goes below 60. And 60 seems to be a cutoff around the country. When you get below 60, that means that you probably had it for quite a while. And the longer you've had it, the harder it is to treat. And also, if you don't have any killer cells, it's kind of like telling my mechanic to go fix my car. And he's like, gee, doc, I don't have any tools. I can kick the tires, I can listen to it, but I really can't do much. Well, I don't fix anybody. Please don't tell anybody that, because I charge for not fixing people. You fix you, okay? But you have to have the tools to fix you. So if you don't have any killer cells, it means your immune system is so pulled down that probably the first 6 months of treatment is just suppressing these organisms until your body can get some tools to fight back. So normal is greater than 120, and below 60 is not so good. Above 60 is a better prognosis. If you're above 60, and you're 20 years of age, you might start feeling pretty good in about 4 months. But usually 4 months is about as soon as anybody starts feeling good. Sure.
Going back to the prevention, what are early signs? I think they talked about that a little bit, and we have the brochures back there, but can you just address what early signs could be of Lyme infection, and should you save ticks and get them tested, and what's your whole thought on it?
Okay. What are the early signs of Lyme disease? That can vary a lot. Your conventional doctor will tell you, well, erythema migrans rash, which is the classic bullseye rash. Well, I'm here to tell you that it's not classic very often. A lot of times it's a red plaque in the area. It doesn't have to be a bullseye. A bite that doesn't heal, especially if you know it's a tick bite, all right? It can just be chronically irritated. And then I would say most often, somewhere around the 2-week part, in most people I talk to, they were hunting, came back 2 weeks later, they're starting to feel funny and achy, flu-like symptoms, fatigue, and that kind of thing. But less than 30% of people see the bullseye rash or any rash. At least 50 or 60% of people never even knew they got a tick bite. All right, don't know where they got it, don't know how they got it. Maybe some of those people, maybe it was a mosquito, maybe it was something else. I don't know. Well, you know, that's not been scientifically proven. But they've recovered Lyme from mosquitoes. Okay. So the symptoms on that sheet that you have or you can get, I mean, it can be any one of those symptoms. Now, some of them are late. Usually you don't have the cognitive signs and symptoms up front. It's usually joint pain, swelling, fatigue are the most common ones up front.
What about testing ticks?
What about what?
Saving the ticks and testing them and...
If you have the tick, and let's talk about ticks for a little bit, the worst thing you can do, I mean, I remember when I was growing up, you touch a tick with a cigarette and they'll back out. You put Vaseline on them. You put gasoline on them. You know, don't do any of that, okay? And don't grab them and squeeze them and pull them out like we've all done, okay? Because that's like a bulb syringe, you know? Think of it. If somebody grabbed you and squeezed your body, what would you do? Everything that was in you would come out your mouth, right? Well, guess where that mouth is? That mouth is in you. So if you grab that tick and squeeze it, you just inoculated everything in that tick into you. And the only way to get a tick out like that is to grab them by his little mouth parts with a little tiny tweezers or a tick remover that they make and try and lift them out that way and get as much of it as you can out, okay? And that's the best way to do that, to minimize your chances. They don't have to be attached for 36 hours like you might have heard. Nobody really knows where the heck that came from, but that's ridiculous. They've recovered Lyme in 6 hours from a spinal fluid after a bite. So it doesn't take 36 hours. But they do have to be embedded in you. They have to bite you, okay? And the deer ticks are small, but they will get 10 times their size if they're engorged. In other words, if they've already fed on you, they can look like a wood tick, or, you know. So, did that answer your question?
What about saving them?
Oh, I'm sorry. I knew there was another part that I forgot. Saving the tick. The ticks can be tested, okay? I would save them in a plastic bag or somewhere where they're not going to escape. And if they're not old, I've had people, yeah, I got this tick 6 months ago. I'm glad you saved it, but it's probably not going to do us much good now. IGeneX does tick testing. There's a number of places that do. It's fairly expensive. I don't recommend it very much, but it's helpful to know if it's a deer tick or not. That's one thing that's helpful to bring in the tick for. Sure.
Is the rash always like a bullseye circle? Can the rash go systemic throughout the whole body or throughout the whole body?
The question was, is the rash always like a bullseye? And no, the rash can look like a plaque, just like a red confluent area. I've seen that a lot. It can be a bullseye. It can be, there's several rashes that are very common, and one of the very common rashes is a lot of red bumps. It's kind of like an early zit that never really gets ahead, but it's a red bump, and that's also very common with treatment. The rash can vary tremendously, and it is not often a bullseye rash. And if you have a bullseye rash and you go into your doctor, he's going to say, well, let's test you. Okay. Well, the test came back negative. It's not Lyme. Well, the test checks for your immune response. That does not happen immediately. It's like checking for you being pregnant one day after you got pregnant. The test is going to say, you're not pregnant, okay? Well, it takes a while for your body to respond and to do that. It probably takes at least a couple of weeks for even the most sensitive test to turn positive. But I've had patient after patient that said, well, the doctor tested me when I had my bullseye rash, and he didn't treat me because he said the test was negative. Or he started me on treatment, and then when the test came, I love this one, when the test came back negative, he said, stop the treatment right now. Sure.
What causes the symptoms from Lyme? Is it the fact of it eating up all your nutrients? Because it doesn't like eat the collagen and stuff in your body up? I mean, what is really causing all the symptoms? Is it after doing what we're doing? Or is it just all the stuff they leave behind?
The question was, what causes the symptoms with Lyme? Well, there's a lot of things. First of all, it's a foreign body. It's a foreign protein, and that causes inflammation. Your body fights any foreigner, okay? So inflammation, if it gets in the joints, for example, inflammation is probably causing the majority of the symptoms. Lyme sucks up coenzyme Q10 and it sucks up magnesium. On the video, they were talking about twitching. Almost everybody will come in with cramps, with twitching, with fasciculations, which are little things moving, except you're not moving them, but you can see it and feel it. That's probably a lack of magnesium, and I put people on magnesium, and that's one of the easiest things to fix, and it's very frustrating to people. So it's both nutrients that it is using in the body, it is physical damage, it goes into the thyroid, for example, and it's like if I have a nail with some paint on it and I pound it into this board, probably some of that paint is going to scrape off on the outside. Well, our killer cells, our soldiers, as they're marching around, they go by the thyroid and they look and they go, wait a minute, foreign protein, attack. And they start attacking that thyroid. They think it's a foreign body or a foreign invader. So it generates a lot of autoimmune processes. The U.S. Army isn't supposed to attack the U.S. Army. Okay, your body's not supposed to attack itself. But a lot of people will have autoimmune diseases precipitated by the Lyme. Hashimoto's thyroiditis is huge. An ANA is a test that you do to look for autoimmune processes. I will usually check that on my Lyme patients because it's usually a low positive. Conventional medicine says, well, once you have an autoimmune disease, you've got that for the rest of your life. It's not going to go away. Well, if it's due to Lyme, I cure them every day. They sure do go away. You get rid of the precipitating factor. So it's physical damage, it's an inflammatory response most of all, it's sucking up nutrients, and it's the autoimmune process that it causes that causes the damage. Plus, when it's scrolling around in your brain up there, you know, that's not good to have things in your brain. And a lot of people, one thing I don't know that anybody understands, but a lot of people see floaters when they have Lyme. And I don't care if it's a 3-year-old who has no idea what a spirochete looks like, but I will ask them to draw me the floaters, and they'll draw the spirochete, okay? Looks like the spring from a ballpoint pen that you kind of stretch out. You've seen them like 50 times tonight here on the show. And I don't know why, because if you go to your eye doctor, it causes blurry vision a lot. You go to your eye doctor, and the eye doctor will say your eyes are fine. And you go, no, they're not. They're blurry. He's like, no, they're not. They're fine. And you're both right. And that's because the camera is fine, and that's all he can check, okay? We think the problem is back here in the control room for the vision, which is where these little guys are back there messing with the dials. And is it something back there that causes these floaters and that actually look like spirochetes? I don't know. So it's actually, it's the bacteria being in the brain that causes the problem too. Sure.
You mentioned the floaters, and then people that have graduated or seem to be over the Lyme symptoms, do they see that the floaters have decreased or?
Usually they'll go away. Almost, the question is, do floaters go away once you're treated? Yeah, they'll usually go away if they're due to Lyme. And that brings up another point. Almost any symptom that you have due to Lyme should resolve completely, with the exception of some neurological problems. I've got some ALS patients that maybe have a foot drop, okay? Probably not going to go away. Nerves are very antisocial, and if a nerve is irritated long enough, it's not going to come back. So, as a matter of fact, this ALS patient went back to his doctor and he said, gee, doc, you know, it's been years now, and there were 2 other guys diagnosed with ALS the same day I was. And he said, they're both dead, and he said, my symptoms haven't progressed at all. He said, how do you explain that? And the doctor went, well, it's highly variable. And I've had some doctors be actually very upset at their patients that they haven't died yet from ALS. You know, isn't that sad? I had a doctor, actually a rheumatologist, one of my patients came in and said, this was a couple of years ago when we had a fairly light winter, you can get ticks every month of the year here. And she actually was digging ticks off of her neck in November and couldn't get one out, had to go in and have her doctor dig out the rest of it. And then 2 weeks later developed these aches and pains, so the doctor sent her to the rheumatologist, and the rheumatologist said, well, you can't have Lyme disease because you can't have a tick in Wisconsin except in June or July. End of story. Yeah, ma'am.
If someone's showing neurological signs, can you time how long they've had Lyme based on that, or is that still strictly based on an individual? Some might get it very early and some might have had it for a long time.
If someone is showing neurological signs, can you use that to determine how long somebody's had it? No. I had a lawyer that went from a very healthy practice to a wheelchair in a year and a half, okay? Fortunately, she's back to a very healthy practice now, and past the wheelchair, past the crutches, past the cane, and doing fine. Some people get hit really hard and really fast with this disease, and I don't know whether it's their immune system or if it's their inoculum that they got, or if it's a particular strain is just a really nasty strain. The best we can do with that, I tell all my patients that every test I get is like one piece of a jigsaw puzzle, and it doesn't give me much information. But when I get enough of those pieces, I get a CD57, I get a C4A, I get the IGenics, I get some other, I get, antibodies to thyroid. And when I get them all together, it's like a jigsaw puzzle. When you start hooking them together, now you start to see a picture. And if I have all of that information, just from experience, I can probably give you a pretty good idea of how long you've had it. And you usually can tell me how long you've had it, or how, my symptoms started 3 years ago. Okay, well then your CD57 should be 60 or higher probably. Your C4A might be elevated, but it's not going to be real elevated. You probably don't have Hashimoto's thyroiditis yet. So by looking at things, I can probably give you an idea, which is a guess, but it's somewhat of an educated guess about how long it's been affecting you. Now, like I said, you might have had it since you were congenital, okay, since you were a baby, but it probably only affected you for this length of time.
So the Lyme produces the ALS?
No, the leading researcher who was on the movie in the country, he did more research on Lyme than anybody else, felt that ALS, MS, and Parkinson's disease were all one disease, and that's Lyme disease. Like the gentleman in Seattle, everybody I have seen with any of those diseases has also had Lyme, okay? I have many ALS patients, I have many MS patients. I have essentially put ALS into remission and MS into remission. That's not supposed to happen, okay? Is there such a thing as Lyme and MS and ALS? I don't know. I personally don't believe in MS, okay? I for sure don't believe in fibromyalgia. To me, that's a set of symptoms. It's not a diagnosis. The funny thing about all of these diseases is there's no test that tells you, okay? So if your doctor says, well, she's got ALS, I say, well, I don't think she does. All right, well, I think she does. Well, it's a shouting match, okay? Because there's no test to know. And most docs don't believe in chronic Lyme, so they got to put a name on this. If you have an MRI, you might have white spots in your brain. Well, a good radiologist will say, consistent with a demyelation process such as MS, an infection, Lyme, or other process. A mediocre radiologist will say, you've got MS, okay? Because they can't tell the difference between the lesions of Lyme and the lesions of MS. So I don't know. If
With the proper treatment, can you reverse the neurological too?
most of the time, like I said, some Lyme symptoms should go away completely. The question, I'm sorry, was if with proper treatment, will most neurologic symptoms go away? Most, but that may not go away. Like my ALS patient that didn't die, he still has his foot drop, okay? But he's like, doc, shoot, I had a death sentence before, that was years ago. I'm supposed to be dead. I can deal with this foot drop, So some neurologic symptoms do not go away. You saw some pretty good examples on there of a lot of neurologic symptoms that went away under our skin. Now, those were pretty severe cases. They were trying to make a point, Well, are we all exhausted? Sounds like it. Well, thanks much. If you have any